So we're discussing retirement, and I'm speaking to Inamarie Oppermann, who is a psychologist and a retired psychologist who lives in Canada. Where exactly do you live, Inamarie? I can't remember the exact location.
It's Calgary, and
Yes.
it's in Alberta, the province of Alberta, one of the western provinces.
Okay. And in terms of how long have you been in Canada? Like, what's the timing?
I came in December 2003. That would
Yeah.
make it now 17, 18 years.
Which is a long time. Yeah.
Yeah, and I became a citizen almost as soon as I qualified to be a citizen. Yeah.
So if I remember your stories, you also like re-careered and you went or not re-careered more than you went and you kind of studied in Canada as well. And
yeah, they required me to do some master's courses again to verify my education, because the scoring system is different in different countries. And they didn't understand my numbers. And then I had to do a big exam that covers all areas of psychology, which was quite intimidating. It's an American exam. They call it the EPPP. And then I had to do an oral with 4 lecturers from 4 different universities who quizzed me on psychology.
Yes. So it was quite intensive to get registered there in Canada, to go across there too. And then your working life, like how long did you work there in Canada, and like at what age did you decide to retire?
Well, I've worked as a psychologist since 1993 in South Africa, and then here. So in total, it's more than 20 years.
Long time.
Yeah, but my work life started when I was in my 20s. And I was planning. Retirement, I think, is also a cultural thing. Because in Canada, they have a number, 85, that they say if you're 55 years old and you have 35 years of work experience, 85 gives you the top pension if you are with a company that gives pension, which means it's not going to increase. So many people here retire at 55, do their fun stuff, and sometimes come back to work.
Oh, wow.
Whereas, so as an immigrant, I was a little bit off the boards there. I tried to work until I was 70. But eventually I retired at 67.
67, okay. And that's, I mean, it's interesting how you explain it in terms of the culture there as well, and how that influences when people actually take the retirement.
Yes, because to them, I was amazed when I saw such young people as 55 retire. But if your retirement fund is not growing, why should you stay? They have this attitude. And then some people stay longer, but most go. And they might, if you are 1 month out of the job, they might take you back as a consultant or in another position if you but then you apply again on the open market, and then you're not contributing to pension, but you can work in another job in the same company.
It's interesting that then as well. So like your decision around retirement, was that also financially driven as well?
I thought I was going to stay and get as much as possible money, but in the end, you have to take your work-life balance. And that I'm very healthy, but my husband is not. And we have quite a journey where we lived in British Columbia to come to Calgary for doctors, specialists. And you have to cross the Rocky Mountains, and that's not so easy in winter. So we decided to come here to be closer to his medical facilities.
So my understanding also is that you've been like the sole provider as well financially for the two of you, and he's had a lot of complexity around his medical needs too. So, so you factored that into your decision as to where would you be able to get good medical support?
Yes, and not that anyone ever wants to be dependent on the government, but there is advantages to live in Alberta for senior citizens, and in a city you have so many more support systems, which we did not have in Revelstoke. We had to travel, say, 6 hours to see a dental specialist, 3 hours there and 3 hours back. And here you have many specialists of every variation, and he's actually with the post-transplant team at a big teaching hospital. So you have all the very best people available.
So it's really, you know, took, like, I suppose, a lot of consideration in terms of planning where you were going to move to for the retirement.
And many people ask why Calgary, because it's much colder than British Columbia. British Columbia is the city where most people go, or the province. And but our consideration was also financially, because there was a buyer's market in Calgary and a seller's market in the ski town where we lived. So it was a good time for us to sell and buy on this side. My house is worth even more now in the ski resort town that we used to live. But unfortunately, the market is going up now in spite of COVID in Calgary, which means I think we bought at the right time here.
At the right time.
So it's like we don't pay anything on our house, on our townhouse, except condo fees. And that is that was part of my planning, because I planned every cent that we spent monthly, and if we can survive on my pension.
Yes. So like very thorough planning on your part, looking at the finances, looking at also like the timing, the right timing to make the decision, and then also like the geography of where to move to and the health considerations. And then you, by the sounds of things, you also projected it into the future of how, like, you know, how long can you sustain both of you and like on your pension, take care of both of you. A lot of stuff. Did you manage to make the decision together? Was it, how did that go?
Well, even immigrating was sort of my decision. But my husband said, as long as I'm happy, he'll go along wherever we go. Because I think mostly when we were younger, he made the biggest financial decisions, but I was always the bookkeeper. So we worked together.
So planning together, discussing it together around moving there. And in terms of retirement, like how did you cope with that adjustment when you did take that decision? Because my understanding is you've almost worked since you were 20 years old. You've always worked, you've cared for your family, you've studied, all of that. Like how do
people ask me what are you going to do? And I felt sort of guilty in the beginning when I'm before the retirement. I thought, what am I going to do? But I think once you retire, and I actually retired a few weeks later officially, because I went on a holiday first, but I was in my new home and I realized how tired I was. And the more time I spent not needing to get up 7 o'clock every morning, not needing to think about the work and subconsciously worrying about my psychology work, because when you work with people, you leave the problems at the office, but subconsciously you're always busy. Your brain is always busy going. And I think it took me the first 4 months to really just zone out. And I was just ready to start going to the senior center and make new friends and do new things, which was also in the plan because there wasn't such vibrant senior centers in the little town, which was more a ski resort for seniors where I used to live. And here there's many opportunities to join groups. And then came COVID.
Of course.
And then I couldn't even leave the house, except we were from the beginning very lucky that anyone could walk anywhere. And there's wonderful walkways around in and around Calgary, and walkways where you can enjoy nature. So I didn't meet new people except through friends. And I just picked up all my hobbies. And I have actually a longer list of to do in my hobbies than what I actually do. In winter, I build puzzles. I do needlework and a lot of fun things. And then I've got online Pilates and yoga with a teacher on Zoom. I mean, it's wonderful.
Amazing.
What the internet.
What it's also implying to me is like you've been very adaptable, you know, because you've not only with migrating, like made friends and things, but then also then moving there, and you rapidly also like adjusted to the COVID requirements. And then you've been like very current from a technology point of view to be able to keep yourself connected by the sounds of things.
I think it's very important that we keep up to date with what is happening in the world. And I think it's also personality, because it's easy to get depressed when you're isolated from outside world. But the few friends I already had in Calgary, because I lived here when I immigrated for 3 years before I went to British Columbia. And I kept in, and we could take walks. We just safely distance and walk and talk. So if you keep your energy up and you stay healthy as possible, then you can really enjoy retirement. Another thing that was cut short was all my ideals too. I have a special savings account for traveling. And I've got Australia on my bucket list, and Japan and Europe, and everything is on hold.
Because of COVID, and this like a huge factor in terms of all of that. And your family also live in South Africa, am I right? There too, kind of, So like also with retirement as well, like how's that been impacted in terms of like connection with family and those things?
Well, I think since the decision to immigrate, and it was to see the world because of the poor exchange rate with South African money, I realized that you can't really enjoy a vacation when you always worry about the exchange rate. And the Canadian passport helps one to not need visas when you go to Europe or anywhere else in the world that acknowledge Canadian passport. So that made it easier for my reason to come here. And I wanted to buy an RV and tour through Canada and through America, which a lot of RV is a big caravan that we say in South Africa, like a house on wheels. And all those plans are on hold, and I hope we might still get there. But the big thing is to rather do your research in the meantime about where you want to do, instead of getting depressed over COVID.
Yeah. So there's like, it sounds again like you've been quite adaptable in terms of your travel plans, is that you're still then exploring it and looking at it from that side, and it's aligned with your values of like that you want to still travel and see the world and do those things. It sounds like you've also been like very cautious and clever in how you've managed your finances to, like, you know, have the savings and the budgeting, which you've had the discipline to do over.
Yeah, but I think one thing that's very important, that people don't feel overwhelmed by advertisements about you need so many millions for retirement.
Yeah.
Because the moment you stop working, you actually stop buying clothes and stuff.
Yeah.
Because I mean, we've only done so a low mileage on our car, for instance, because we don't travel to work anymore.
Yeah.
I have more than enough clothes, and there's some that I haven't even touched in this 2 years that I'm retired now. So your whole wardrobe changes, but it's actually, you don't really need so much. And we really find that it was easier for us to make a list. I actually have an Excel sheet that we can just
Excel
tick.
spreadsheet.
Yes, you just tick in this line for today what I'm going to buy at the store in terms of food. And you don't have to wonder, because one thing about getting old is accepting you might forget something that's important. And then if we have something special that's not on the list, it gets added to the end by pen. And therefore, we also try and manage getting older in a positive way.
Yes, it makes sense, because you're kind of structuring your world and making it easier from that side. And there's some anticipation of just like changes to the brain kind of as well, in terms of, you know, whereas your memory may not be the sharpest, or all those kind of things.
You know, you walk into a room and you don't know, what am I doing here? Oh, I forgot.
I have that all the time, and I'm like, I think I'm what, about 10 years or maybe
or more
younger than you. But yeah, I would love to retire at 55. That's not going to happen yet. What do you think the culture is like there also in Canada, in terms of like just towards the older generation? Like, is there a lot of ageism? Is there discrimination? Or how do you think people are treated in terms of like facilities even, or those things?
Yeah, there is a lot of facilities in Calgary, and from all levels. And this is where, because there's even people for the homeless. There is drop-in centers, and there is beds available for people who live on the street, who don't want to live indoors all the time, but there is shelters for them. That's very nice. And I've volunteered there once with a group of young people that I worked at the YWCA. And they feed people wonderful food. We were dishing food there. So I think in terms of discrimination, if there's discrimination, it's below the radar. People don't. Otherwise, people are extremely polite in Canada. That's very true. They're not direct. They won't tell you directly. They're so wonderful. The moment they meet you, they give you a compliment. They always find something. Oh, I like your scarf. Oh, I like your pants, you know, and things like that. And very respectful. So we have a lot of people from the Philippines and other countries that work here as care aides. And that is one thing. I doubt being fit, I might not ever go to an old age home, for care, because if one can afford it, you can bring a carer in.
Yes.
But they are being organized by government organizations that run their hours. But being seniors, the doctor's office just organized for qualified nurses to come in when my husband had skin lesions, that they had to come and clean and dress because it was on the ear, too difficult for me to do. And they came in and we never saw a bill for that.
That's very good, because you're talking about like medical support that is that comes out to your home, like in terms of that. That's good.
And if you're in a low income, there's a rate for how much you pay for home care, somebody to come in to help you with medication or taking a bath. And then there's a system of assisted living in terms of your income. And then finally frail care in terms of your income.
So you've already like looked into that, obviously, in terms of like what's the long term.
Yes, because we are on different levels, and there's things I can do. I'm a good chauffeur, but I'm not a nurse and I'm not a care aide. Because those people get taught how to help somebody into and out of a bath, for instance. And if you don't have the training, you can hurt yourself. So I'm not volunteering for that.
And in that way, I would imagine it also like keeps the kind of integrity of your relationship in terms of the kind of the married relationship, as opposed to putting you into like a more nursing capacity. So that it would take some of the stress out, knowing that you can bring someone in. So like it sounds like in terms of your retirement as well, like you keep yourself very busy with the hobbies and things. You've got like the plans to travel, and I know you also like you exercise a lot, you walk a lot, you get out and think. Where do you feel like you get your meaning in retirement now? Like, if you define it in your role or any of those things, like where do you feel the meaning is as well in the state?
Well, I think still my relationship with my friends, because I have friends all over the world. I've got a friend in Brisbane. I've got friends in Perth and Melbourne, and in New Zealand is family. And I keep in very close contact with my family, especially my mother, who's 93.
Wow.
I found she's still living in her own house, and she's still cleaning her own house and cooking and doing little gardening.
Good.
So if I'm going to live that long, I've got another 25 years to go. So I have to pace myself. And then I was hoping to do a volunteer work. I thought I'm done with psychology, but I really still like people. So at the library, because we have a constant flow of immigrants, I don't want to teach English as a second language, but at the library you can volunteer for conversational English.
Lovely.
Where I can just go there and talk to immigrant adults, because they've got a daycare at the library. It's a community center, and there's a swimming pool, and then there's meeting rooms.
Lovely.
And that's where I would like to volunteer.
So it's really nice, because you're saying it's structured in that way, and then also like it still feels purposeful that you're helping people with the conversational English, but it also takes away some of the kind of stress of the role. Like for many years you worked as a psychologist, and you worked like with a lot of complex cases, and kept yourself very current and all of those things. So it's still engaging your mind and giving back to the community, but in a different way now as well.
And they are very strict here. You can't just walk in and be a volunteer. You have to apply. And then you have to do a security check. They want to make sure you don't have a criminal record.
Yeah.
And things like that, so that you're not a predator coming to work with vulnerable immigrants who struggle with their language.
Yeah, so in that way, there's like a safety in place around protecting people who might be more vulnerable as well because of the English language. The other thing I wanted to ask you is just if you think of for counsellors that are going to be working with, let's say, couples or just individuals in helping them to do retirement planning, you know, what are some of the things that you think they should be like looking out for or aware of, or just like even any ideas around like just how to approach retirement planning?
Well, I think the number one thing is that they have to ask the client first, what are your fears?
Yes.
Because I think that is most important, that some parents, if they have children, think they have to stay in the I'm saving because I want my child to inherit something. And that is a big stumbling block for many people. And I learned that with my mother-in-law before she passed away, that we encouraged her to spend her money on herself. And I think that is something that if you lived your whole life giving, then you don't know how to take for yourself. And what does a big savings account in the bank mean while you yourself don't enjoy your retirement?
So valuable what you're saying. And I think like also the contrast to, you know, of like elements of elder abuse when families are also like using their parents' money as well, like because you do sadly get incidents of that. But it's just giving them permission to say, focus on making your life meaningful and using your money to make your life enjoyable as well.
Yeah, we have to be very careful because I've seen with my mother being over 90 and cousins and family approaching her to borrow money from her. Now, there's one principle that's very important and that I've learned, and that is if somebody approaches you to borrow money, you always tell them, if I can give you the money, I will give it to you because I don't lend out money. Because that's the bank's job. So if you can't borrow money from the bank, I'm not a bank, but I can give you $10.
And it's allowing people to have boundaries as well, just to say that, you know,
because especially if you were a person who had a problem saying no, so the counselor will get to know their client and see if they are shy or intimidated, and say they've got a client who was always subservient to the partner, either male or female partner, then they might be a target for family members who understand that they can't say no.
It's lovely what you're saying is like just try and understand the client's fears, you know, like what are your fears around it, but also like to have that brave kind of open conversation around the finances and also around their dynamics in their relationship and those things, and then the boundaries.
And for single people who eventually become single during retirement, there's so many of my friends whose husbands died in the year before or after their retirement,
which is so sad.
And yes, because they as a couple had so many plans, and then they're just not there anymore. And I've got a wonderful friend who 3 years after her husband passed away, just before retirement, she's got a friend now, but she has very clear boundaries. We each pay our own way. All the meals they do together, they go Dutch. And if he wants no sleepovers, we can visit one another, but stay at your own place. There's so many men who are so used to women looking after them.
Yes.
Or women who are so used to men looking after them that they hand over their whole lives to a new person before they even know them well.
That's a very interesting thing you've brought up. Like, I never even thought of that, because like you've got somebody having to like negotiate a new relationship and doing it by putting boundaries in, and from that side.
So never ever marry a person when you're over 65. Just stay friends, stay partners, and one night sleep over, that's fine, but don't let the other person move in.
Because of keeping some level of separateness or some integrity around your own relationship.
And if you want to walk away from the relationship, you don't have the emotional roller coaster to dissolve a second marriage or a third marriage. And so what if your children is not happy that you having sex, which is most probably impossible, with a man in your dad's bed? I mean, it's not their business.
So like that's also interesting too, because you're saying like old-fashioned values and things, and it's requiring like almost like a more modern mindset around relationships as well.
And I think this is also a lot to do with culture, because the North American divorce rate is much, much higher than a more religious country like South Africa used to be. I'm talking about the mostly white population that goes to church, and it's a sin to get divorced. Whereas here, oh my goodness, they just cut it and walk away much easier. Not hampered by religious laws. And therefore, I think it's easier to say to a guy, I'm sorry, we can be friends.
I'm curious too, like just also around, do you think like people going into retirement and like going into like the older kind of years are accessing counseling and doing things like even couples counseling, or doing individual counseling, or even doing like sex therapy or any of those things? Like, is that happening? Or, I mean,
I wouldn't be aware of that. And because I think it's mostly people who already experiences problems during their younger years might continue with that and feel comfortable. But in general, I know that there is more social workers get involved when they are involved with a couple who has different medical needs, and then there's a social worker working with them. But what we do have more here in Canada that is, there's many groups for different, say you have a lung problem, then there's that group of people where you can go and find peer support.
That's lovely. So yes, peer support groups around, is it mainly like around medical kind of concerns and things?
But that's actually the things that causes depression when you struggle to. So there is a transplant peer group if I needed it, but at this stage I don't. But on the other hand, I think a lot of people are very healthy in Canada. It's like visiting friends yesterday, and he asked me, now, what do you do in winter, Inamarie? And I said, well, I learned at 55 to ski downhill.
Very good.
And I've got snowshoes. So if the snow is too thick, You can't really just walk. It's easier to walk on top of the snow than through the snow. And they play curling, rocks, with the rocks that they throw. And he said, well, they've got people who just learned to curl after 65. So I can even go and learn how to do curling.
To do that,
But I've got so many things to do, I don't have enough time. And actually, in the first year of COVID, when we had the most lockdowns, I read 120 books online. Through our library that's free on my phone and my tablet.
So it sounds, I mean, you've painted a nice picture of retirement for me as well, like just around, you've really made the most already of it in terms of like continually keeping yourself current and reading and just engaging in your hobbies and making sure that you're connected, you know, and then positive messages around also realizing that you don't need as much financially, you know, that you can plan for it, and you can also be, your expenses come down a bit too. And
don't be overwhelmed by a number when they say, oh, you need $1 million. That's idealistic. I mean, if I had all the money that I needed to immigrate, I would never have immigrated.
True.
You know.
So you've been good at just also taking those decisions and making the moves, and and even just moving into a different part of the country as well to access better support. So
I mean, one needs to go out and ask for help. I got quite depressed last year being in winter, but then there is your family doctor that can help you and can refer you to services. And I was thinking again, yes, it's available.
It's accessing that and feeling okay about accessing that. The thing that stands out for me is also you saying like to make your shopping easier and to kind of structure things, to say, you know, we're doing things differently now because our memory might not be as sharp as possible. So you're anticipating and you're making stuff easier to do that. So any other final thoughts, Inamarie, like you have around just retirement? And I mean, you've given like a lot of strategies for us to use as counsellors.
I think if people can have an open mind about retirement, and that's not the end of the world, it's actually the start of a new era in your life. And I think in terms of, I looked at my dad lived to 85 and my mother is still alive. So the average is 89. I'm looking forward to 89. And if something happens in the meantime, it's like COVID. It just comes and you deal with it. Because living in the moment is actually the best thing for an older person. Enjoy today, forget about the past, and don't worry too much about the future. Except for planning your trips.
So it's a healthy way of also like just saying like, what do I have control over, and trying to like remind people to focus on the present, and good strategies as well around you using your money in terms of your own self-care and your own enjoyment.
And there's many people who say COVID is stealing our age because we're losing trips. 2020 and 2021 trips is gone forever. But if you dwell on that negative, then I mean, it's much better to start planning the next trip in terms of researching online and which cities do you want to visit, than complaining about what could not. Could have, would have, I mean, should have. No, it's not helping.
Which is really nice. It feels like you need to be back counselling some of the people, the older generation, but it sounds like you want to do the library volunteering more.
Well, if I get the need
Yeah.
to do that, but I also have to take my home situation. I
Yeah.
don't want to bind myself to something or commit myself to something that I can't continue.
Yeah.
And unfortunately, registration is very expensive
Yeah.
to stay registered. And I've cancelled my registration and I drew a line.
Yeah.
And without registration, I can't really help people.
And you're also saying like it's around that stage of your life now where you're also saying like you know, this is your time, and this is also opportunity for you to do enrichment and enjoyment without the stress that you hold in the other working space. Yeah.
And it's subconscious stress.
Yes. Yeah.
Because I always believe that I leave my job problems at the office in the filing cabinet, and then I deal with my home stuff. But once you retire, you realize what a big job it actually was. And I don't have to worry about teenagers who don't want to live anymore. And I don't have to worry about kids who has anorexia and don't want to eat. And, you know, because you always have a responsibility in your life, and if you work according to the ethics, you have all those rules and regulations that you always have to check that you're on the right path. And I just feel free now.
It's good.
I'm only responsible for myself and my spouse.
It's something for me to look forward to. Like, you've given me like a positive view, and like also you've made it less daunting as well. Like a sense of, if you plan and if you really focus on the positive and on the now, that there's a lot that's possible from that side.
And enjoy your work life as much as possible now, so that you have no regrets. And that is the main thing, to look back on your life and not say, oh, if only. Now you've tried, you need to be able to say, I did what I planned to do or tried to do.
It's nice wisdom that you're offering there. So it's now late evening for me, and it's an early morning for you in Canada.
Yes.
At the moment.
So do you want to stop recording?
Yes, so I will. I'll end this, and thank you for the time that you've spent with me, Inamarie. It's like been very useful. I'm going to share this.
You can buy me a meal when I get in.
When you come, I'll definitely buy you a meal, a nice meal here in Australia. Okay. Thank you for your time.